Hello, everyone, and welcome to the Digital Oracle Cloud World. We're really excited to have you here for our session on what happens at the intersection of fusion applications in healthcare. So first, I'd like to introduce myself. My name is Nancy Estell Zoder, and I'm Vice President of Product Strategy for Oracle Cloud HCM. And with me is Kristen Miles. Kristen, you want to introduce yourself?
Sure. Hi, everyone. My name is Kristen Miles. I am a Senior Director of Healthcare Supply Chain Product Strategy.
And we're thrilled to be here to really share with you some of the involvement that we're having with our customers in the healthcare industry and what some of the key opportunities that we're seeing cross-pillar for our healthcare customers, especially as we see a big evolution from the workforce perspective as well as from the supplier perspective. So what I wanted to do was just take a couple of minutes to share some of the key challenges we're seeing on the HCM side, as well as Kristen really covering some of the partnership opportunities we're seeing with our customers. So one of the key things that we're seeing, especially for our healthcare customers and the evolving workforce, are some of the resource challenges associated with that workforce. What we're also seeing is a need for not just Oracle and the healthcare customer, but for the entire ecosystem to work more closely together in order to better support that evolving workplace and environment of work. And this is where we see some unique opportunities for not just us, but the entire ecosystem around not just providing them better support of HR, at least from my perspective, or for supply chain from Kristen's perspective, but really to focus in on providing better patient care for the healthcare customer. And we're really excited to share with you some of the recent investments that we've made in our product in order to better support precisely that with the partnership of our customers. And so from the HCM side, couple of the key things that we've really been focusing on include things like the true evolution of talent acquisition to talent access. We know that the challenges within healthcare, especially for the evolving workforce of healthcare to support the evolving needs of patient care, is challenging. Customers have had to take a very unique approach in order to address some of those key challenges, and our solutions are there to support them. Some of the recent investments that we've made include things like the focus that we have on the skills imperative, really understanding the skills that are required in order to better support all of the various workers within the healthcare system. That includes from the hospital staff to the administrative staff and optimizing the workforce based on the skills that exist within the organization. We're not only providing the ability to manage those skills effectively, but to better align and position those skills for the future in order to support those changing needs. So we recently announced the availability of our Team Skills Center to support precisely that. One of the other key areas that we've really focused on was around the financial value of workforce optimization. Now, there's a component of that really looks at the skills planning element, as well as really better understanding the budgetary components and drivers of the workforce plan itself. And so as we've looked at the ability to effectively manage financial agility with workforce productivity, we've heavily invested in our solutions cross-pillar in order to better support our end customer in the healthcare space in partnership with our enterprise performance management solution with strategic workforce planning, where we have the ability to manage some of the scenario plans in order to better support some of those changing needs, short-term as well as long-term. And with our strategic workforce planning solution, we in fact provide that simple, comprehensive solution to manage those plans across finance and HR. One of the key things that we definitely recognize as it relates to the healthcare space is that healthcare is highly complex, highly regulated, and requires frequent organizational changes in order to better support their patient needs. And our solution with strategic workforce planning and HCM enables the support of precisely that. It starts with the demand planning, truly understanding what is required within the organization, to determine what it is that they need to plan for with the supply, based on the supply of the organization. Is there a need to hire from outside of the organization? Is there a need to recognize that there may be some changing needs of the work that needs to get done and the different types of workers? We see a big evolution of that within the healthcare space specifically, primarily because of the lack of talent and the lack of skills and the changing skills that are required that healthcare organizations need to meet and support. And so that assessment of that workforce skill becomes that much more critical day to day. This isn't an annual planning process. And especially in the healthcare space, there's changing demand that is taking place on a more frequent basis. And as we've seen over the past couple of years, could change month to month or even more frequently. With that, there's a need to have a good understanding of not just the workforce skills, but how to assess what's really required in order to better manage that gap. And so within our solutions, we provide the ability to not just manage that supply and demand, but that analysis that's required to make those recommendations. And then we take it one step further. We look at how we can, in fact, incorporate those changes within HCM to make it effective. We want to be able to take that what if scenario planning and modeling and ensure that it's going to be the most effective change for the organization, financially as well as structurally, and especially from a performance standpoint. So when we think of some of that gap closing analysis and those recommendations, that's where it becomes that much more critical to make sure that we understand, is there a need to hire? Is there a need to have internal transfers within the organization? Perhaps there's an opportunity to share resources based on the work that needs to get done. A lot of the organizations have a requirement to better understand what those gap closing options are, and we provide precisely that with the solution supported by our analytics. And so we've really looked at this collectively across understanding, the workforce skills, but then also being able to calculate that operational demand with that workforce supply in order to analyze as well as do the gap close and defining that gap closing strategy. All critical components for our healthcare customers. And just as the last piece, at least as it relates to some of the key challenges that we're seeing, really being able to provide that enterprise value for that employee experience. Because we see so many changing needs within the healthcare space, specifically for their workforce, there's a need to ensure that they're enabling those workers, contingent as well as employees, in a personalized, contextual way. And so we recently announced the availability of Oracle Me, which enables organizations to have that complete employee experience platform that empowers talent to connect, grow, and thrive in a single environment, in a single cloud, to best support that secure, but also seamless user experience to manage those employee moments that matter. It really starts with Oracle Journeys. We've actually had Oracle Journeys for a little while now, about 18 months now, give or take a couple of months. And, we've seen the largest adoption of this feature across our platform. This solution is not just an HCM solution. Oracle Journeys is part of our employee experience platform, which can be supported across our cloud. To streamline the experience, ensure that it's personalized and contextual based on who, where, and where they are in the relationship with their organization. And then, of course, there's still support that may be required or other services that are required, which is why we have an Oracle HR help desk natively built and supported within the Oracle Cloud to ensure that we're adhering to data privacy practices, not duplicating any of that very sensitive employee or just people data, ensures that we can provide the services that all the people need within the healthcare institution. And then with that, of course, when we think of the support that's required, especially within the healthcare industry, where there is a need to have support around the clock, we have the ability to manage some of the automated support through the use of our Oracle Digital Assistant. So hopefully what you've been able to see is that, we've really taken the lead. We've really been focused on providing solutions for the evolving healthcare customer and providing a complete solution that's natively built for the cloud to support those changing needs. And so with that, we're in fact managing those continued engagements through our Cloud Customer Connect, as well as through other partnerships within our organization across our pillars, to ensure that the engagement is there, but also to ensure that we're optimizing the needs of the future healthcare worker and to best support them as those needs evolve. So Kristen, I'll hand it over to you to really dive into the Oracle and healthcare partnership value and some of those opportunities as we continue to move forward.
Absolutely. Thanks so much. I think it becomes really important as we look at healthcare organizations in totality, right? That it is made up of all of these workers who are looking to be able to do their jobs faster and easier. There is, as we all know, a limited amount of talent out there. And so we as a technology provider need to look for ways to make those employees their lives just that much easier. So we're looking to do that through a series of technology enhancements, but also being able to pull the technology together in better and more efficient ways, connecting systems, taking that front office patient or clinical application, pulling it into the back office, into the operational side, and informing the ability to informing decisions, informing practice and service line strategies, being able to ultimately impact how we best serve our patients and also our employees. Here at Oracle, what we've done on the supply chain side is very similar to what Nancy referenced on what is happening in the HCM. So we are taking the feedback of customers. We have customer advisory boards that are in from healthcare, of all shapes and sizes around the globe, and they're informing where we're investing our money and where we're taking enhancements and prioritization. So things that we've been able to bring to market, things like healthcare analytics as an example. It takes all of the data from all of the different pillars within the Oracle Fusion environment, pulls it all together along with that front office EHR, can also pull in information from revenue, and being able to start to take a look at what are these cases costing to deliver care? What is this episode of care going to cost, inclusive of salaries, the roles of the people in the organization, and what does that mean to the outcomes? As an example, one of the things that we've heard from our customers is that it's not always procedural costs that dictate or determine the patient outcome. In many cases, it's the mix of strategies. It can sometimes be the level of people that are involved in that patient episode of care. And so these healthcare analytics start to allow you to dig into that. We have very specific healthcare analytics pre-built and pre-piped into these analytic platforms to really help bring people together from across the organization to make business decisions. We also, now moving right into like the nitty gritty of supply chain, have invested in specific areas that have been really problematic and manual for supply chain folks. So supplier rebates, as an example, they're really hard to manage. They're a key source of income for many of our healthcare organizations, and they typically are done on a spreadsheet. They're done retroactively. There's no real ability to manage the cash that revenue stream brings in. So we've been now able to automate that by tying it into the day-to-day transactional details that occur within the supply chain application. Another opportunity, Nancy mentioned demand planning and being able to understand the demand of the employees that could be occurring in an organization. The same is true when you talk about supplies. What are we going to need over the
Mm-hmm.
next 90 days for supplies? What are the things that are going to impact that? Tying in procedural schedules, tying in patient diagnosis. So, as an example, there's a fire in town, and all of a sudden you see an uptick of burn patients. That means I'm going to probably need a lot more burn treatment supplies than normal. Being able to understand that and take those different factors into consideration and begin to replenish my inventory so that I'm not running out, patients aren't at risk, we're able to deliver optimal care. Additionally, a few things that are very unique to healthcare, and we don't necessarily see this in other industries, things like complex pricing, working with group purchasing organizations, GPOs, who are negotiating contracts and pricing on behalf of their members, which are typically hospitals, physician practices, and the like, and being able to augment that pricing with what is locally negotiated and then manage and maintain your systems. Master data is a key source of pain and a place where healthcare customers have invested heavily in resources. And so by moving some of that to an automated process, they're able to redeploy those employees to places that really could use their talent and move to a more exception-based management solution. We've done that. We partnered with the GPOs in the ecosystem. GHX is another one of our partners in that area. We've then also gone ahead and product recall management. As you can imagine, patient safety is an incredibly it's top of mind for every healthcare customer. So there are manual processes that are occurring to manage recalls, which that can impact lives, quite frankly, and being able to do it and do it fast and identify those goods that may be sitting within your four walls that could have an adverse patient event. So we tie that into the FDA, being able to pull in that data on a daily basis, quickly identify where those affected goods may be laying within your inventories or implanted into a patient, and being able to create a series of tasks that you can manage until closure. So you have complete confidence that you have mitigated the risk and informed all of the appropriate parties so that you can ensure patient safety. Finally, item substitution. I don't think there's a person in this country or around the globe that has not been affected by these supply chain shortages. People who never even knew what supply chain was until the pandemic now fully understand all of the different parts and pieces that can get in the way. And healthcare has been no exception. They have had to come up with creative ways of sourcing goods to be able to manage this. They've done it manually. They've done it on the backs of their workforce. So we have put into place automation and smart intelligence to be able to handle some of these supply chain disruptions, inclusive of automatically replacing items with known substitutes and things of that nature to really drive down the amount of manual effort that's required. We continue to work with those customers to refine that. It's a huge opportunity and area of focus for us right now. We continue to work with our customers. As I've said, all of those capabilities have been customer driven. We've worked extensively with them. Not only are we working with our customer advisory boards, which you'll see here in the middle, we also have the opportunity to work with research organizations and helping assist in finding cures with our clinical applications and our clinical trial applications. Very exciting stuff. And we're also working with public health organizations and tracking and monitoring not only the clinical trials, but administration of vaccines. I think we all thought COVID would be the last one. We're now on to monitoring and tracking monkeypox vaccines. And we are fully prepared for the next thing to come down the pike and keeping it is top of mind for everyone, keeping our patients safe.
Great. Awesome. Well, thank you, Kristen. And thank you, everyone, for joining us today. We hope we get to see you in person at CloudWorld in Las Vegas, where we're going to have the opportunity to bring Northwell Health and UHG, who will be able to share their story around the successes that they've had, especially over the past couple of years, and most importantly, around the partnership and the importance of the partnership with Oracle. We're excited to see you and hope to see you soon. Thank you.
Thank you.